The timer, and here is your question. Right, so if you have read and understood, considering a critical care scenario, kindly tell me, how would you manage this patient now? How would you manage the patient now?
Hello, ma'am.
Yes. How would you manage this patient now, considering it a critical care scenario?
Considering this scenario, I will manage the patient according to ATLS protocol.
Yes.
So I will check the ARA and then and breathing, ventilation, circulation, and disability, and we as there is patient is hypothermia, suffering from hypothermia. I will try to maintain his temperature by any.
What is the definition of hypothermia?
When body's core temperature is below 35 degrees centigrade, then it's called hypothermia.
What are the ways by which core body temperature can be measured?
Core body temperature can be measured by oral, axillary, rectal, esophageal.
Yes.
Way.
Yes, and tympanic membrane. Okay, can you tell me what are the causes that might cause hypothermia in a patient, in a surgical patient or in a patient?
In surgical patient, patient may be hypothermic due to hypovolemic shock due to blood loss, and due to maybe prolonged surgery, prolonged period of, due to prolonged period of fasting, cold anesthetic drug, and cold IV fluid.
Yes.
And
blood transfusion.
And due
to
environment, massive complication of massive blood transfusion and less environment temperature.
Good. Can you please tell me what are the complications which can occur as a result of hypothermia?
As a result of hypothermia, there may be a series of complications, such as in cardiovascular, there may be a myocardial infarction, arrhythmia, and respiratory, there is ventricular perfusion mismatch, increased gas solubility. In hematological, there is platelet dysfunction, and there is increased oxygen binding with the hemoglobin, lead to hypoxia, and there is DIC, chance of development of DIC. And
good. Can you mention some mechanisms or factors which lie behind this process of hypothermia?
There are some ways a person or patient may lose heat, such as conduction, convection, radiation, evaporation, and patient loss mainly heat through radiation.
And what are the factors which contribute to hypothermia?
There is some factor if the patient is prolonged period of fasting and is the room temperature is below 21
cold anesthetic, cold anesthetic.
Cold anesthetic drug, cold IV fluid. There is patient is prolonged emergency surgery, and there is a prolonged period of surgery, and is the postoperative room there is the temperature is not maintained.
Good. According to the NICE guidelines, what are the risks, what are the measures that you can take to reduce the risk of hypothermia?
Yes, ma'am. We can, according to NICE guideline, we can reduce the chance of hypothermia by lessen the time of period of fasting before surgery, and maintain the OT temperature above 21 degrees centigrade, and the IV fluid will should be warm, and there is period of surgery time should be less, and there is in the post-operative period, if the body temperature is not above 36 degrees centigrade, then induction of anesthesia should not be started. And if there is any chance of hypothermia, then body warming device should be used. And in the post-operative period, the doctor should not leave the patient, post-operative patient, is if the body temperature is not above 36 degrees centigrade.
Okay, what are the measures that can be taken to warm up a patient during surgery and or post-operative?
During surgery, the ambient temperature can be raised, and if there is a raised by the increasing the room temperature.
Okay,
and in
good.
emergency laparotomy, there is irrigation by warm fluid in the
Yes.
peritoneal cavity.
Yes.
And the blanket, a space blanket, by the space blanket and bed hugger, the air warming device,
Yes.
the temperature may be increased, and warm IV fluid by warm.
All right, good. In this patient, there is ABGs mentioned. How would you, can you comment on it?
Yes, ma'am. There is pH is less than 7.35, and
Yes.
lactic acid is more than 5.
Yes.
So patient is suffering from metabolic acidosis with
Yes.
hyperkalemia.
Yes. How could this be corrected?
This can be the potassium
Or what are the
hyperkalemia.
consequences that if you fail to correct this metabolic acidosis, what can happen?
Due to metabolic acidosis occurs due to hypoxia, so patient there is maybe
what are the consequences that can occur?
Yes.
What is ARDS, which leads to TRALI trolley? What is it?
Yes, ma'am. Transfusion related acute lung injury.
Yes, how it takes place, how it occurs.
It occurs when there is a massive blood transfusion, and due to some due to immunological reaction and immunological reaction in the lung, the transfusion related lung injury happens.
Not quite satisfied with this answer, but okay. Right. How would you correct potassium hypokalemia?
Potassium, I can correct potassium by infusion of calcium gluconate, and then insulin with dextrose
And
can be corrected. And
in Sing notes, there are 3, 4, 5 points written very nicely. So maybe you can go back and look. And how would you correct the base deficit? 10.5. Is it normal?
No,
how much should it be?
Plus 2 to minus 2, I think.
So this ABG questions, you'll go back and read, because
Yes,
this is very important.
Yes, ma'am.
In this, they'll give you an ABG to read. Here I've already written, but they can give you an ABGs and you would have to comment on it. And yes, it's better to go through it, read through it, so that you can comment on it very nicely. And to correct hyperkalemia, there are 3, 4 points written very nicely. You can go back and read those and memorize them, so that on the fingertip you can tell, right?
Okay, ma'am.
And the causes as well, if you can learn those in classification, like if you can classify those and learn those, like Yeah. Intrinsic and extrinsic causes of hypothermia. So,
Okay,
like if
okay,
you give a classification, it gives a good
classification.
impression that you know it in a better way. So you are giving it like giving causes in a better range. So it gives a good impression. It's just that. Good.
Okay, okay, ma'am.
Thank you.
Thank you, ma'am.
Okay.
And here is your question. Though not much, just this. I should have written more. I'll improve. I'll write more next time. Right. So if you have read and understood, considering the procedure skill station, kindly tell me how would you proceed?
For this, I will wash hands and I will enter the station. I will introduce myself.
Yes. So
Should
what
I
is your?
do like real?
Yes, we have
Okay.
started the timer and we'll practice it.
Right. Hello, good day. My name is
Yes.
Kadi. I'm one of the surgical doctors looking after you. May I please confirm your name and age?
Yes. Tom. 50 years old.
All right. Nice to meet you and thank you for seeing me today. Today, I have been asked to remove a lesion in your skin, and I just want to remove the lesion because I have to do a test and make sure what is causing this lesion. I will try my best that nothing bad happened, but in some unfortunate circumstances, there could be pain, there could be bleeding, there could be infection. But still, I will try that nothing bad happens. I will also have to expose your area so would that be okay?
Yes.
Okay, okay. Then I also need to ask you a few questions for your safety of WHO checklist, if you don't mind.
Okay.
Can you please show me your ID?
Yes. You'll
Can you
confirm the
please?
ID from the arm, from the wrist. Okay.
Okay.
You can say, can I confirm your ID from your wrist? Okay, then continue.
Can you confirm your ID from your wrist?
Yes.
And
Local anesthetic has been given and consent has been taken. Now continue.
okay, okay. And can you confirm me the side?
Yes, right side.
Okay. And can you confirm me the procedure?
Excision of
Okay.
NAVES. Yes.
Okay. So I will gather my equipment and I will get back to you. So
Yes.
I will gather sterile gloves of size 7.5 and I will get scalpel and blade and a measuring tape, a scale, a pencil, and also I will get sutures, silk 30, an island 40, whichever will be available, and I will get antiseptic solution, and I will also get the surgical drafts or sterile area, and I will come back to patient, and I will confirm uh, from the patient about the. Do you have any allergy to latex, iodine, or local anesthetic?
No.
Okay, and do you have do you have diabetes? Are you using any blood thinners?
No.
Okay, okay. So I will. I just want to feel your area. Did you feel pain here?
No.
Please let me. Okay, that's good. Okay, now I will start with the. First of all, I will choose the scale and I will mark.
Very good. Very good. Yes.
Length should be 3 times more than the width. So I will mark along the length line.
Yes.
And first I will First I will mark width and then 3 times the length.
Yes.
And then I will put it back. And if there is any assistant, I will say, okay, scale back to you, mark back to you. Now I need scalpel and blade.
Yes.
So I will get that, and I will from the one side I will insert it at right angle. And
insert what? Okay.
Scalpel right angle.
Yes. Yes.
And then I will bend it slightly, make an angle of 45 to 50. And then
But before you do that, you have to make sure with the forceps if anesthetic has started working by pinching gently on the skin.
Okay. Again, I will pinch and I will ask, do you feel pain?
Yes.
And
good.
Okay,
If not,
and
then excise. Yes.
Right. And then I will insert the scalpel at right angle, and then I will start cutting first on the right, first on one side, and then I will complete the half, and then I will start from the other side, adjacent to the side where I put my scalpel before. So I will complete it into two cuts. I will complete in two cuts, and then with the tooth forceps, I will hold it from the above end, and if it is still adjacent to the lower skin, I will try to cut with the scalpel, and I will be moving it and slowly, and then I will remove it completely, and I will ask the pathology jar. I will
Very
put it
good.
in that.
Yes.
Then I will.
You'll put and you label.
Yeah, I will put a label, and I will also hold the glass piece, and I will just put it just to act that there is no bleeding.
Very
And
good.
then I will put the scalpel blade and the glass piece back in the tray, and I will pick the suture nylon skill 30 nylon 40, and
if it is on the right arm, just pose how many sutures you'll give and which suture material you'll use.
Nylon 40.
Okay, how many stitches you'll give?
It would depend upon the area. Like if I will keep the suture 2 centimeter apart.
Yes.
From each other.
Good.
And if a suture will depend upon the area. So I will start from the side, and I will first I will give 2 throws, and then I will give 3 more throws, and I will for every upcoming throw I will move the suture in one time.
Yes.
Okay, and then after completing the switching, and I will ask for the dressing, simple dressing.
Yes.
After cleaning with the glass, I will insert the dressing, and after that, I will discard my gloves. I will also put the my suture material and forceps back and discard my gloves, and remove my gown.
Sharp objects in a bin.
Sharp objects would be in a separate bin, and glove in a separate bin. And then I will give the post-procedure advice, and I will ask the assistant, is the instrument count complete? I will also ask, and then I will give post-procedure advice sorry, post-procedure advice. And after that, I will ask for to document in the patient's notes. I will ask to document. I also request for the histopathology form. And after that, I will wash my hands and.
Okay, very quickly, what is the post-procedural advice you'll give?
So for this patient, I will ask, I will
Yes.
say to the patient that you have to see me again in 7 to 10 days. Sorry, you have to see your GP in 7 to 10 days for removal of sutures.
Yes.
However, if you feel any pain or if you feel oozing of blood or any problem, then you should contact me immediately, or you can contact your GP. And if you see any warning sign, you should not hesitate to contact.
Very good. Okay. Can you tell me what are Langerhans lines?
Langerhans lines are the lines that correspond to the natural orientation of the collagen fibers in the dermis.
Yes.
And generally, these are parallel or horizontal to the orientation of the underlying muscle fibers.
Okay, good. Right. All right. Okay. Thank you. So according to this one, you introduced yourself. This can give you maximum 1 mark. So you achieved that. You confirmed the consent. This can give you 2 marks and you got that. You'll check you did mark the incision. So it can give you maximum 1 mark and you achieved that. You confirm for the allergies and bleeding disorders. So you got full 2 marks for that. You confirm for the checking of the local anesthetic. So you got full mark for that. You have chosen appropriate equipment for this one. This gives you 2 marks and you got both. You made the incision elliptical, which was 3 times bigger than what you told me of the lesion. So you got full mark for that. You removed the NAVES, you got full mark for that. And you closed the wound appropriately, you got 2 marks for that. Maximum you can get 2. You send the offers to mark the sutures with you close the wound with the sutures, so you got 2 marks for that. You sent it for histology, you got 1 mark for that. You applied the dressing, appropriate dressing on it, you got 1 mark for that. So post-operative instructions you gave clearly, so you got 2 marks for that. And you disposed of your equipment safely accordingly, so you got 1 mark for that. So full marks according to this. So there's no need to repeat.
Ma'am, I think I missed important thing. Antiseptic solution should be applied along with surgical dress.
They haven't mentioned, have they?
Okay.
Let's check. They haven't mentioned, but yes, pyridine, etc. But you did ask if patient is allergic to anything, so that means that you confirmed and you applied. If it's given, then you'll apply. If it's not given, then you can ask to confirm, just like in a routine that everyone carries out. Good, thank you.